Heart emergency room doctor says he is retiring from Sacred Heart because the hospital is no longer putting patient care and patient safety at the top of their priority list. Dr. Johan Orjovich has worked at Sacred Heart's ER since 1988, and he feels he has no choice but to quit because he can't continue working there in good conscience. KXLY4's Tori Brunetti spoke with the doctor today, who says he wanted to speak out now before the situation gets worse.
Dr. Orjovich says he took the job at Sacred Heart 23 years ago because of the freedom he had to treat any and all patients. But now he says he's retiring because he feels that freedom is slowly being taken away.
When I started at Sacred Heart in 1988, I absolutely promised myself I'd never be put in a position to have to do a wallet biopsy on my patients.
Dr. Johan Orjovich says a lot has changed at Sacred Heart in the past 23 years.
One of my co-workers in the emergency department just last month, for instance, was at a meeting where one of the administrators specifically stated that the priorities in the emergency department were #1, profit, #2, productivity, and #3, patient care.
He's resigning in part because of a 30% pay cut, but more importantly, he says not only is patient care suffering, patient safety is starting to suffer too.
You can't do the same amount of work with lesser staff without something giving.
Dr. Jeff Collins is the chief medical officer at Sacred Heart. He does not deny they have had cutbacks on staffing.
It's nice to have a lot of redundancy and a lot of extra staff and extra resources sort of laying around, but we can't afford that anymore. So that's our struggle, is to be more efficient, to use our resources as efficiently as we can, and to try to match those resources with the need of the community.
Dr. Collins says medical care is more expensive, and because of the economy, more and more people do not have health care. But he says their financial struggles have not and will not impact patient care or patient safety.
The fact is, we continue to see all patients regardless of their ability to pay.
Dr. Orjovich says his goal is not to discourage people from going to Sacred Heart's ER because he thinks people can still get quality care. But he wants to change the direction Sacred Heart is going before things get worse and lives are lost.
I don't personally know of any sentinel events to date which have directly caused a patient to die or a horrible outcome. But if the direction continues in the direction that I see right now, that will happen. I'm confident of that.
Tori Brunetti, KXLY4 HD News.